Legal advice, because there's always small print. We must remind you that the health advice given on this show is general advice, and that for any specific condition you must seek the help and guidance of your doctor or a professional medical advisor before commencing any treatment or any kind of dietary regime. And the health show here on ExpatLive.TV, today an emotive subject, but an important subject in terms of breast health, breast care, with our team of alternative practitioners.
Thank you, Jeremy. Hello and welcome. I'm Leonie Amond, kinesiologist and sports therapist.
I'm Liz Nagel, naturopath and thermographer.
I'm Jeremy Kenton, an osteopath.
I'm Juliet, yoga teacher and a life coach.
Kate Mask, yoga teacher.
An emotive subject, to the point where even before we began recording we were talking about the emotive issues behind all this.
But an important subject.
Vitally important. But one thing I'd like to get across is in terms of the fact that something as simple as, and this goes for everybody, male and female, because it's not just a female issue. Men can get breast cancer, men can get testicular cancer. There are lots and lots of things where unless you examine yourself and you know what the norm feels like, how it should feel normally, you're never going to know if there's something abnormal. And that's a very important part. The classic things for the breast are in terms of inverted nipples, but that can be misleading because that can be a congenital fault and not anything to worry about.
I think the difference, I mean, you can just have inverted nipples, but if it suddenly becomes inverted,
that's
the problem.
Or lumps, or bumps, or swellings, dimpling, puckering of the nipple.
Or rash.
A rash, change in shape.
Yeah, obviously not when you just had a cold shower and everything just shrivels up.
Yeah.
That's not puckering.
But it
No.
shrivel either, does it?
Yeah. And we're talking about breasts, not testicles.
Right.
But an important differentiation. But that whole thing in terms of normal anatomy, you've got to know what your normal is. And that's why self-examination of all parts of the body is important. If something looks wrong, feels wrong, then don't be afraid to do anything about it.
Yes, quite often your partner might recognise a change in your breast shape or form, or notice a lump. You know, sometimes if you're not looking at them, your partner might notice that they look different from one side, or there's a slight lump or a change in contour maybe.
Yeah, and the important thing is not to get too worried if there is, because most even lumps that are found, 95% of lumps that are found in breasts are completely benign, and not to get overly freaked out. In my practice, because as a thermographer, I do breast health screenings using the thermography, which just takes a heat picture of the body. Heat picture is
so thermal imaging.
It's thermal imaging, yeah. So that's a very non-invasive way of just checking generally the health of the breast. It's suitable for everyone from any age, from 16 up or even younger. I have done people, but mostly 16 and on up. And it's really just about getting a basic baseline reading, and then when we do annual screenings after that, we can see if there's anything odd happening, any abnormalities. And most, again, of those abnormalities are completely benign and totally reversible. I do a whole breast health program that includes diet and detoxing, hydrotherapies, hot and cold water, and just general.
So it's more about preventative.
It's all about prevention, and it's all about staying healthy, but also it's about knowing what's normal for you, and that's really it, because we're all different. So it's what's normal for you, and if there's any change there, then don't be afraid to come and get it looked up, because it's more than likely benign. Just wanted to give you a little demonstration of how thermography works, because we were talking about it earlier in the show, and thought it would be useful to see it actually being demonstrated. And we have our lovely model here again. And thanks for helping me out with this. So I'm just going to show, we're obviously not going to do breast health at this point, but I'm just going to show you how simple it is to get a thermography scan done. So Ben, if you just put your feet flat on the ground and look straight at the camera, straight ahead at the camera, okay? And I'm going to just click and take your picture and record it on my laptop. Cool, and now if you turn to your right or left, whichever, and give me a profile, looking straight ahead. Thank you, and we just do it again, and turn it all the way around to the other side. That's great, and we'll do it again. Lovely, that's perfect, and it's as simple as that. Now with the breast screening we have a few more shots, and we actually we'll take shots under the arm and see the breastplate and under both arms, and we're taking both sides so that we can compare one side of the body to the other.
So I'm just wondering, like looking at these pictures as well, how do you tell the difference between what's happening on the skin and what's happening underneath?
Underneath. Well, sometimes it can be a little bit difficult, and I just take a note of that. If you had cut yourself shaving, for instance, and I just take a note. But generally speaking, what we're looking at is the autonomic nervous system, and the nerves come from deep inside the body out through the spine in a symmetrical pattern. So we know that where they come out on the surface of the skin and what organs or internal processes might be affected by the heat that shows up on the skin. I should say that I send these scans off, and it's a medical doctor that actually reads them and sends back their report, and they have very sophisticated software that helps them to see the relative heat and whether it's a surface heat or a deeper heat as well. Does that answer your question?
Yeah. So how would this differ from getting an X-ray done, should we say? Okay,
well, X-ray shows structural and anything calcified inside the body. Whereas the thermal imaging is showing physiology, it's showing the blood supply, it's showing the nerve supply. It's showing what's going on in the body, the processes that are going on in the body. So from that point of view, it's very interesting. Just as a basic health screening tool. It's very important, and using this, an annual screening to see what's going on can just put your mind at rest. So you're not living in fear, and you're not sticking your head in the sand either, because you're actually, doing something proactive.
Yeah.
You've got a very important sort of viewpoint in terms of bras, which is very, very important. I mean, for me as an osteopath, it's important.
Yeah,
but for you,
I get these regular emails from this fantastic woman, and they're all about alternative ways to look after your body and in your life. And she sent one out about being braless, and apparently there was this 15-year-old study, and she sent out this link. As to how bras, actually, if you don't wear a bra, it doesn't necessarily make your breasts saggy, but it can actually make them stronger, because then you're using the muscles.
The pectoral muscles stay strong.
Yeah, so rather than have them always being supported, they're building the muscles. It's like, using them, like we've spoken about before. She also speaks about massage. So lang lang oil is something you can add to almond oil. It's an essential oil, just a couple of drops. And
why would that work? Why would that help? What would it do?
So the oil basically helps to stimulate and the muscles,
Right.
and the skin around the breasts. And as you massage, when you're massaging anything, you know, like if you have a massage of sports massage or something, you are stimulating the circulation,
Yeah.
and strength. You can help basically build the strength of the muscles.
Helps rejuvenate cell growth, doesn't it, as well?
Yeah.
I mean, it's that whole thing. As a man, I don't wear a bra normally.
Yeah.
Very lucky.
But in terms of that, I mean, do you find your bras always comfortable? Do you have your bra fitted?
Because from comes off when I get home, actually.
Yeah, because it's uncomfortable.
Which is really, really important. I think that women shouldn't be wearing underwired bras because they can cut off the circulation and cause lymph to stagnate. And, you know, and anywhere there's stagnation, there's going to be a build-up of heat, which can lead to an inflammatory process. So underwired bras, unless you're going to a wedding or a night out or something special, just leave them off. Just have no wire. Also, synthetic fabrics are not good for
They
the
can
skin.
aggravate, they build up local heat.
You know, leave your bra off, and don't be going out to buy, you know, your teenage daughter a bra as soon as her breasts start to come in.
It's also fantastic for fashion as well, because then you can wear any style top. You don't have to worry about your straps showing.
Yes, absolutely. I think I see the argument for heavy-breasted women, but you know, that maybe they just feel they need a little lift, and that's fine if you're going out to work or whatever. But as soon as you get in the door, take it off.
Right.
Take it off. Go braless as much as you can.
I mean, for me as an osteopath, it's often the case that you see patients with problems in their upper back because of an ill-fitting bra. And it shocks me that it's very difficult for you ladies, not for me, to find somebody who will fit the bra properly.
Well, I recently went to a shop. Went to a shop, and they said that they wouldn't give me a specific cup size or back size. They tested my specific shape, and then because different companies, different bras have different sizes as well, and they were very specific, and they're very attentive, and they check you in detail and help you out.
So it's interesting about the fitting of bras or ill-fitting of brassieres. I've noticed with patients that are quite sizable, have sizable breasts, that their bras are obviously ill-fitting because they've got very big indentations on their shoulders.
Oh God, yes.
And it actually feels like it's changed the bone almost. Is that possible? Or is it just muscular?
It's purely muscular, and we can put up a picture behind us now showing that classic dimple effect with the bra strap, but that can so easily be solved by wearing a wider bra strap, which unfortunately isn't fashionable. But if it's not showing, don't worry about it. But the thing you've got to remember is if you push down on a muscle, it will push back, and you've only got to look at some women where their shoulders are up near their ears because of the wrongly fitted bra, the strap's too narrow, or they wear it in such a way that it's coming up at the back. The bra fastening at the back's too high because it's the wrong fitting, putting huge pressure on the shoulders, the neck.
Generally, quite a lot of larger breast women obviously do tend to hang forward or have a slightly more humped back. I mean, is there any way that they can help that?
Well, the old trick is to try and make somebody think that they're like a puppet with a single string attached here. So if the head is held up, their posture will be better, but your posture is perfect. Perfection personified. But also adolescent girls, where their breasts are beginning to grow, they become embarrassed, they become withdrawn.
Yeah, I see a lot of that in
Their posture's
yoga.
affected.
Yeah.
And if they get older and their breasts are large, they become even more aware of it. It's like tall people as well, not pointing any fingers, where you tend to slouch because you're dealing with people who are smaller than you. So that has a huge bearing on it.
Tallest in the school.
Yeah. But carrying a heavy handbag on one shoulder or the other, that can also affect your lymph congestion. Again, we're back to stagnation and problems in the breasts.
You're compressing blood vessels.
You are, yeah. So I just would like to get back to focusing on preventative things that you can do to help keep your breasts healthy. And I think what Juliet was saying there about the massage and everything, I think that's really important.
Could I just say one point, which I think is actually quite important, that if you were to find a lump, in my professional opinion, it would not be wise to massage that. You should seek medical attention.
Oh, yes.
Not just suddenly start thinking, well, I'm going to massage that quite deeply.
Certainly no deep massage, no, it should be...
you don't want to stimulate the blood supply to what could potentially be a growing area of abnormal tissue.
There's that, and also you just don't want to aggravate the area at all.
The massage is just on a daily basis.
General daily basis.
Upkeep.
Yeah, it's just upkeep. So, but there's, again, oxygenation and breathing exercises are really important, and there's diaphragmatic breathing that you can do to just increase the oxygen levels. And when you've got those oxygen levels high in your blood, then you can use the hydrotherapy, hot and cold water, like a bowl of ice, iced water and a cloth and your hot shower, and you just put the cold
so when would you be doing this?
So if there's if something, say, if there was a congestion, lymph congestion, or if something showed up, like in the thermography, like a small hot spot. With thermography, we're picking things up long before it's could ever be a calcified lump or a tumour. Okay, you're just picking up an abnormality.
Or an inflammation in the area.
Inflammation in the area, but it's usually a hot spot. So to disperse that, you can just put the cold cloth on, and then put the hot, and then the cold, and then the hot water. And after you've done the breathing, you're bringing all that oxygenated blood in,
so
moving it again.
If you were to spot something like that using thermography, what would be your next port of call?
Well, I would suggest, which is what I do, we've got a 3-month window between taking the first scan and the second scan 3 months later.
Right, but if you found something at that first thermography scan, what would you be recommending for the patient?
This is what I'm about to tell you, is that we've got a 3-month window. So we would do all the breathing exercises, the detox, the hydrotherapy, a whole breast health program to see what's going on, and if we can just cool the whole area down over that 3-month period.
But do you not feel it would need further investigation rather than leaving it 3 months?
No,
it's a long time to leave it.
Well,
But
because we're picking up things that are not a problem, really. If it was okay, so we're given a guideline. It could be, it depends on how pronounced
let me
the
stop you
problem
there.
is. No,
You've got somebody.
Let me just finish, Jeremy. Let me just finish. It depends on how pronounced the abnormality is, okay? And so if it was very pronounced, then we might suggest ultrasound would be the next step, because it's the next non-invasive, non-toxic test that you can do. And after that, perhaps blood tumour markers, blood tests. We're talking from a naturopathic point of view. On the other hand, if somebody wants to go to their doctor, that's their choice also.
Right, but if a patient came to you as a naturopath and you spotted something, you'd leave it for 3 months before you'd have it further investigated.
It really
Are we
depends.
talking of something which is accompanied by other signs, symptoms?
If something is accompanied by other signs and symptoms, then that's a whole other case, you have to look at each case.
But I'm just picking up on the fact that you said you leave it for 3 months.
3 months, yeah, I would, because we're picking things up with thermography for up to 8 to 10 years ahead of anything ever being even possibly visible with X-ray.
So would a tumour be apparent in a thermography scan? Have you thermographically scanned people with a fairly active?
It's not a standalone diagnostic test, but we could see a pattern that might suggest a tumour, but it could just be just a benign cyst.
Or mastitis, or a number of
would
conditions.
look very different.
Right.
Okay.
Isolated around the nipple.
Isolated mark, but that could be just a cyst, or an abscess. It may not be a tumour at all. But that's where it would require maybe further investigation.
Right.
It just depends on.
And that
what
further
we're looking for.
investigation, would you advocate the use of mammography, which I know, once again, is an emotive subject, the whole thing of compressing a breast and using X-ray?
Personally, I wouldn't, but I would think ultrasound would be the next, or the shear wave ultrasound, as well as this new shear wave elasticity, I think it's
Right.
called.
I mean, there are a number of sonographic methods now
Yes.
using ultrasound
Yeah.
rather than X-ray.
Yeah.
But X-ray itself, not a pleasant experience, and routine screening, not a pleasant experience.
Not pleasant, and there's a lot of controversy about the routine screening as well, whether you're picking up things that are called precancerous conditions and or zero stage cancer, which is not cancer, and people are being treated as if they're full-blown cancer patients, and getting mastectomies and radiography and chemotherapy.
And we already have cancerous cells in us, don't we? That they're just not actively taking over the body, as it were, like the dangerous
they
cancerous
come and
cells.
they go. If the body is healthy, then the body will be able to deal with it and rid the body of it. We don't need to be interfering all the time.
I think it's one of those subjects, like vaccines, which I have many conversations with several people with, where because me personally, I would take the alternative route, but I know other people would definitely go straight down the medical route with the doctor.
Yeah, but then they're not going to be coming to us.
No, I think it's very much personal
sometimes
choice.
They do, and that's fine. They can
But do you not feel that there's an obligation, though, for you to say to the patient, this is the approach that I want to take with you, but there will be an attendant risk of me missing something?
There's an attendant risk in everything.
No, but there's
a
narrow dividing line between something where somebody would take an approach based on informed consent. And I totally agree with you in terms of that they should be more selective in terms of which patients are regularly screened, and not screening somebody who shows no markers but then giving them repeat mammograms. But for this, surely it's your responsibility as a practitioner to address the issue of giving somebody all the information that they can make the decision of leaving it or taking the more normal orthodox route.
Well, they don't just leave it if they come to me. I take the responsible attitude that if they've come to me, then they're coming to me for my opinion on how to treat this naturally. If they want to go to a doctor, I will still support them naturally as much as I can, but that's their choice. I don't tell people what to do. I give them options and I educate them. That's my job as a naturopath, is to educate people on their options and to give them an alternative way, if that's what
and then
they
there are individual cases where the women just do not want to go into the hospital.
Oh, of course not.
I've had a client who had discovered a lump and just wanted to have it looked at by a nurse, really, and the nurse said, no, you've got to go straight to the hospital. And she didn't want to go. She'd never really liked being in a hospital environment. She didn't like the invasiveness of a hospital environment. And when she refused treatment or diagnosis there, they wanted to obviously sign something saying, well, in which case you've been, and you have to sign this to say that you don't want to receive our medical assistance. And so she did go ahead with having some explorative tests done and some, sorry, you have to help me, biopsy.
Biopsy, yeah.
And she truly believes that the biopsy actually proliferated
Accelerated
the cells.
And there is evidence to suggest that.
And I think in the program that you support, that maybe we'll at some point we'll see a small section of that program, which promotes the thermography. I think what it's really showing is that there are other ways of keeping the breast healthy and keeping an eye monitoring the breast health over a very long period of time, like 10 years, 20 years.
And I think thermography is very good in that respect. All that concerns me is in terms of people being steered towards it as the only approach.
No, I don't think that's necessarily what's happening at all. I think
approach, and it's a proactive approach, and it's a really excellent screening tool, which is really what we're meant to be doing, is just screening for health.
Yeah.
And
a harmless tool
as well. A harmless tool. Yeah. That's the point. Is not screening with an agent that can actually cause cancer, which X-ray can.
Yeah.
And not being invasive and using biopsy and maybe puncturing a tumour and spreading cancer.
And causing cancer spillage. But the thing is always, I agree with you on all those last three things, but the other thing you always have to take from a medical perspective is what's called the risk-benefit factor. Do any risks that you put the patient through, are they outweighed by the benefits that the patient will receive as a result of the appropriate treatment?
I think with all alternative therapy, I think you really need to say to every patient that you see that your practice isn't there to cure them. There is no cure for the majority of illnesses out there, really. There are medical cures, but those cures don't always work for everybody. They're quite unique cases where they do work. So an alternative practitioner is really looking at a complementary route of preventative healthcare, supporting the patient in maintaining a very healthy well-being. And
not actually treating
we're not
particular problem.
The diseases as such. We're hoping to prevent disease from taking place. If you look at the word disease, it's dis-ease. When you're healthy and you have well-being, you're at ease, and when you're not at ease, you have dis-ease. And so, as an alternative practitioner, really what we're doing is trying to prevent disease from taking place. And some of the topics that we've looked at in our program so far, like stress and digestion, all of those areas that we've been looking at, and now breast care as well. It's we live in a busy lifestyles with lots of pressures. We often don't do things how we would like to do them. We should sit and eat in a certain way. We should go to the bathroom in a certain way. There are healthy ways to do things, and I think what alternative therapists are really trying to do is educate, as Liz has been saying, the whole world, in whatever way they can. It is almost like our ambition to try and educate people to be aware of themselves. Be aware of themselves, be aware of their health, and how best to maintain their health.
And one important part of that awareness is self-examination. And what we'll do is we'll put a website address on, which will show people with a video how to do self-breast examination. But remember that whole thing in terms of normality, in terms of seeing what's the norm and what isn't. So from this rather emotive and interesting, if not argumentative show, that's all for today's health show today. Thank you very much.
Thank you.